Allergic rhinitis. Rhin comes from Greek word meaning nose, and itis means inflammation. So, it means inflammation of the nose. And allergic means it's caused by allergens. Allergens are anything harmless or neutral that can be inhaled in air by nose and trigger excessive immune reaction. Common examples of allergens include pollen and dust. Once inside nose, they will meet immune system, particularly mast cells, attached to IgE antibodies. Allergen will bind to IgE antibody, which will then activate and alert mast cells. In a normal person, the reaction is minimal. But in those suffering from allergic rhinitis, this cell overreacts big time. It signals to all cells in surrounding by releasing histamine. Histamine will now cause inflammation and swelling up of nasal mucosa, which will then cause excessive mucus production. This results in nasal drip. This excessive mucus production will block two very important structures opening a nose. 1. Nasolacrimal duct. The purpose of this duct is to drain tears from eyes into nose. But once blocked by excessive mucus production by allergic rhinitis, now you will start having watery eyes. 2. Eustachian tube. This drains drainage from middle ear, with it blocked too by excessive mucus production by allergic rhinitis. Now, you will have stuffed ear sensation too. Finally, the nerves in nasal cavity will start getting irritated and lead to sneezing. All of it will lead to difficulty in breathing for persons suffering from allergic rhinitis. To summarize, allergic rhinitis will lead to 1. The swelling and congestion of nasal mucosa. 2. Watery eyes. 3. Stuffed ears. 4. Nasal drip due to excessive mucus production. 5. Sneezing. 6. Difficulty breathing. For diagnosis of allergic rhinitis, 1. Patient history. Usually the person complains of all symptoms mentioned above, and if the timing of these symptoms is specific and seasonal, then we can easily reach a diagnosis of seasonal allergic rhinitis. 2. Skin prick testing. In this test, allergen is introduced using a skin prick, and reaction of body is seen to confirm allergy to a particular allergen. 3. Blood test. A. Total blood eosinophil count. As with the total serum IgE, an elevated eosinophil count supports the diagnosis of allergic rhinitis. B. Total serum IgE. This is a measurement of the total level of IgE in the blood. An elevated serum IgE level supports allergic rhinitis diagnosis. This test can be performed using radioallergol sorbent method, hence it is also called as RAS test. 4. Nasal smear test. A nasal smear can sometimes be helpful for establishing the diagnosis of allergic rhinitis. A sample of secretions and cells is scraped from the surface of the nasal mucosa using a special sampling probe. Treatment of allergic rhinitis is achieved by targeting different steps in pathway to allergy. 1. Avoid allergens. This can be done by taking precautionary measures to avoid exposure. For example, wearing face masks in pollen season. 2. Decrease inflammation. This can be achieved by steroids applied directly to nasal mucosa. 3. Antihistamines. These target the action of histamines by blocking the histamine receptors, thus stopping the action of histamine. 4. Mast cell stabilizers. Mast cell stabilizers are common medications used to prevent or control certain allergic disorders. They block a calcium channel essential for mast cell degranulation, stabilizing the cell and thereby preventing the release of histamine. 5. Immunotherapy. When you get immunotherapy in the form of allergy shots, your allergist or doctor injects small doses of substances that you are allergic to, allergens, under your skin. This helps your body get used to the allergen, which can result in fewer or less severe symptoms of allergic rhinitis. Hope you enjoyed this lesson too. If you have benefited from it, please do support us on Patreon to enable us to make such lessons more frequently in future. Let's make medical education universal, free, state-of-the-art, and available to every human being, which will then help all healthcare givers to get better healthcare education, and in return, give better healthcare to the community they are serving. This project will benefit hundreds of millions of human beings get access to better healthcare.